welcome to another episode of this channel. Today we are going to talk about arthritis. Arthritis is common and affects a lot of people. It's painful, it affects the joints mainly, and it's inflammation of the joints. So a lot of people suffer from arthritis. It's mainly in older people, but it can also affect children. So we're going to go through arthritis today. It's a long topic. I do have footnotes so that I don't forget to mention anything under the whole arthritis disease process. So if you see me looking aside, it's because I do have footnotes that I'm going to talk about on arthritis. So arthritis is a disease that affects your joints. So anywhere that the joints meet, the fingers, the hands, the knees, the back, it can affect there. It can cause pain to those areas. And so we'll go through that, and we'll go through the types of arthritis and how to make it better, how to make it manageable for some people, because some people it's so severe that the joints cause so much pain and it's debilitating for them. So we talked about the most common: feet, hands, knees, back. That's mostly where arthritis is. If you hear most people complaining, they'll say their joints are hurting, mainly the hands, feet, back, and knees. Those are the most common areas. It can affect anywhere else, but those are the most common areas that it usually affects. Hips too. Some people will have arthritis in the hips that become so severe that they're unable to walk, or walking causes them pain. So arthritis can affect those areas. There are multiple types of arthritis. I'll go through one by one. Osteoarthritis, which is caused by wear and tear, that is osteoarthritis. And then you have ankylosing spondylitis, that is in the back. It usually appears in the back and can cause pain. All kind of arthritis will cause pain, but most of them are unmanageable when they have flared up. They are manageable with medications. Another type of arthritis is juvenile arthritis that affects mostly juveniles, which are children 16 and below in most cases. Gout, a disease that causes inflammation to the joint, so you can have gout arthritis. Another type of arthritis is rheumatoid arthritis. That's the most common one in older people, where the joints flare up, severely painful. If you do look at some people, you find like their hand joints are deformed from the arthritis, especially in the fingers or in the toes, but mostly in the fingers. That's most commonly comes from the rheumatoid arthritis that most people know about. Psoriatic arthritis comes from an autoimmune disease called psoriasis. It is a rash, and that can cause severe psoriatic arthritis. That's another type of arthritis. Not so common, but it happens. Not so common as osteoarthritis and rheumatoid arthritis. Every time we talk about arthritis, most people consider it to be rheumatoid arthritis or osteoarthritis, but there are different types of arthritis. Gout arthritis, psoriatic arthritis, that's caused from the autoimmune, and then rheumatoid arthritis, the most common one. Juvenile arthritis, children 16 years old, younger. And then I forgot one, ankylosing spondylitis, that's the one that affects the back. Those are the main kinds of arthritis that most people go through in their lifetime. Mostly it affects older people, mostly women, but it can affect anybody. But mostly in older ages when you start feeling it more than younger people. The younger people get the juvenile arthritis, but older people most likely osteo and rheumatoid arthritis. So those are the common types of arthritis. How common is it? About 50 million people in the US have arthritis. So pretty common. So pretty common. Main complaint is joint in their pains. For some, when the season changes, it's too cold or too hot, the pain worsens. So depending, some people the warmth helps them, and some people some people with arthritis will tell you it's going to be cold because they can sense it, their body can sense it before the season changes. So those are the two main. Most people being affected by the colder seasons, but there are those who are affected by the warm seasons. So it can go either way. Only that majority are from the cold. They feel it, the pain was during cold season. Um, Symptoms and causes of arthritis, family history of arthritis, wear and tear on the joints, and then certain autoimmune diseases and viral infections can cause arthritis. But mainly wear and tear on the joints and family history are the most common causes of arthritis. Risk factors for arthritis, age, as we talked about, because the older you get, the risk is higher. It doesn't mean that if you're old you have to have arthritis, but the risk is higher for you. Lifestyle, smoking causes you to have an increased risk for arthritis. Most of arthritis is in women. Men can have it, but it's worse in women. I've seen men with it, but it's always worse in women. You can say if men get it, maybe 1 in 5 men, and then women is maybe 3 in 5 women. So that's how common it is. Weight, obesity, putting extra weight on your joints, that's a risk factor that can also cause arthritis. What are the symptoms? Pain, swelling, inflammation, tenderness, and warmth. Those are the main kind of symptoms. The joints will be so painful, so tender, hard to move, deformed for some of them when the arthritis is so severe. Those are the main symptoms that you can watch out for if you're having pain in your joints mainly. Stiffness. Stiffness is another one. I forgot that. Stiffness. Are there diagnoses and tests to be done? Yes, there are, but most doctors will tell you that it is arthritis without doing the tests. So you can have the test, but most people are able to diagnose it without you having any imaging test like an ultrasound or an x-ray to say that this is arthritis. They will show on the report that it could be a case of worsening arthritis, but most doctors will be able to diagnose it without imaging of any sort, just by experience and multiple years of seeing the same thing over and over again. They can tell you. Now, there are patients who will request to have the imaging. Nothing wrong with that. You can have the imaging, and the image will also show the same. It will say in the report that it is arthritis, but basically most doctors are able to tell you it's arthritis without ordering imaging for you. It can show cartilage breakdown. In the imaging, it will show cartilage breakdown. It will show muscle ligaments for you to see on your imaging. It depends on the x-ray take. Some will call you and say, you see what you're seeing here, this is what this is. And some just send out the report to your doctor and have the doctor read it to you. Or sometimes they'll give you a CD, and the CD then can tell you, you can review that with your doctor, and they can show you exactly where this arthritis is, where it's worse, and what's causing the pain, you know. There's a blood test for it, like the rheumatoid arthritis. You can do a blood test for it, but as I said, not necessarily do you have to have the test to be told it's arthritis. Experienced doctors, people who have seen it over and over again, will tell you it's arthritis without imaging or doing blood work for you. Some people want a reassurance for the blood work. If you want a reassurance, they'll always do that for you, and if the levels are elevated, then they can tell you you do have the arthritis. Okay, how do you manage and treat it? Arthritis is treated by medications, mainly what we call NSAIDs, non-steroidal anti-inflammatories, such as ibuprofen. It comes by many names. There's ibuprofen, there's Celexa, there's naproxen, Advil. All those will reduce the inflammation. You do have Tylenol, and they have now Tylenol arthritis. So that some people it works for them, and there are some people who say, I did take the Tylenol arthritis, didn't help much with my pain. So then they stick to the NSAIDs, what we call NSAIDs, Aleve, ibuprofen, Celexa, naproxen, interchangeable. And they'll use that, and those kind of medications work really well with inflammation. So you'll find more people trending towards using NSAIDs compared to something like Tylenol. Granted, if it is osteoarthritis, Tylenol does work better for osteoarthritis. If it's rheumatoid arthritis, then the ibuprofen tends to work better. They'll always tell you not to use ibuprofen on an empty stomach because it does sometimes cause GI issues. So if you decide to take any of the NSAIDs, ibuprofen, Advil, naproxen, Celexa, take with food. Amazing drugs for inflammation, but they are hard on the stomach. They can affect your stomach and they can cause GI issues. So take those with food. Amazing for pain. They'll take away the pain. Just remember to take them with food. You can't take them on an empty stomach. Tylenol you can take on an empty stomach. It won't affect you as much, but ibuprofen, naproxen, Aleve, Advil, Celexa, those don't take on an empty stomach. So that's what most people use for inflammation. It works great for inflammation. There are some people who do a dose of steroids when the arthritis is so severe. They'll do a dose of steroids, maybe 5 days worth of steroids, just to calm it down so that it's manageable for them, because it is such severe pain, it is almost unbearable for some people. The ones who have the severe arthritis, the joints are deformed from the arthritis, those people sometimes need a dose of steroids, maybe 5 days, calm it down, and then they're able to go on with their life. So some people use steroids. Some people use physical therapy. Physical therapy will help with the pain. They go to therapy and this helps with the pain. NSAIDs, medications, steroids, injections, cortisone shots. You'll hear a lot of people saying they go for cortisone shots mostly 3 times a year. Most doctors won't do it more than 4 times a year. So steroid shots, you can go for them. Sometimes they hold on for a while. You can have no pain for 3 or 6 months. And sometimes you have the steroid shot and 2 weeks later you still have pain. So it just depends. It's a trial that some people are willing to take and say, you know what, the pain is not what I can handle, so I don't mind trying the steroid shot, whether it lasts for 1 week or 6 months or 3 months, whatever works for you. So cortisone shots, some people will do that. So you can either do the steroid oral medication or the cortisone shots, whatever your choice is or whatever works better for you. Just remember the steroid shots you're not given so often. 3 times maximum, about 4 times a year, and that's enough for you just because of the side effects of steroid shots. So you don't want to take that more often, and most doctors will not allow you to take it more often than you should. So keep that in mind if you do go for the shots, but oral is another way to go. Injections is another way to go, and Tylenol or over-the-counter medications just to calm it down and then get it all going. Some people opt for nice exercises like swimming, which is easier on the joints and helps them feel better. Some people will soak themselves in a tub so that it eases the pain on the joints. So whichever is yours, whichever works for you is fine. It's a debilitating disease, so whatever makes it comfortable for you, use it to make it a little bit more bearable for you. Do you need surgery for it? Some people have a joint replacement. Some people have a fusion where the joints are fused together to decrease that pain. So if it is unbearable, some doctors will consider doing that. Those are the 2 surgeries they do, a joint replacement or fusion. Those are the main 2 that they do for you. If the joint is damaged from the arthritis, they can do a joint replacement for you. So those are options you have later on that you can think about. Most people just know how to control and maintain the flares, so they decide not to do surgery. So those are the usual things. How can I prevent arthritis? Decrease the weight, because too much weight on the joints is not good for the joints. Avoid smoking. It increases the risk for arthritis flares. Doing low impact exercises, that helps. It helps prevent the arthritis. Reducing your risk of injury, because injuries increase the risk of arthritis. So example, running. Most people run. The truth of the matter is the pressure, if you're running on pavement on the joints, is not immediate. It takes a few years and build up, especially you're running on pavement and you don't have the right shoes. That can cause severe joint issues later on in life. Not when you're running. It is later on in life. It will be hard for you to squat. You start having joint pain and all this. So if you're running, it is advisable to run on grass and not pavement. The reason to avoid pavement is the pounding over time. It gets to your joints. So you won't realize it when you're doing it, but after a long time of doing the same thing, pounding, eventually the joints will start aching. So avoid those exercises, high impact exercises if you can. There are people who can do it and don't necessarily get knee or arthritis pain, and that's okay. But if you can avoid it, do low impact exercises. They're easy for you: walking, swimming, those that are easy on the joints and won't cause long-term pain or long-term damage to the joints. Avoid smoking if you can. That's a high risk factor. Maintain a healthy body weight and take care of yourself. Take care of yourself. That reduces all these pains that we get later in life. Another one is, what do people do to live with arthritis? There's no cure for arthritis. It's usually just maintenance. Trying to maintain it and treating it slowly, doing therapy for some people, doing over-the-counter medications, over-the-counter creams. They have capsaicin cream. They have multiple creams over-the-counter that you can use for Voltaren. I can't even name all of them. There are so many. There's Voltaren, there's diclofenac, there's capsaicin. So whichever cream it is, these are external creams that you apply. Some people use patches to put on the affected area, especially if you have like a knee pain or knee joint. They'll put a pain patch there, or spray. They have sprays that you can use. So whatever it is that helps you feel better with your arthritis, if it is a patch, if it is an oral, if it's a cream, whatever reduces the pain for you is what you use. But it's a disease that's managed. I couldn't tell you that, oh, it's absolutely cured. Most people just manage arthritis. Activity. Most people increase their activity. This helps with arthritis. Activity, so that you're not having stiff joints, because stiff joints will worsen the arthritis. So moving, a little bit of moving, a little bit of exercise, a little bit of stretching, that will help us reduce the risk of worsening arthritis or gaining, joint pain that doesn't go away. So exercise, low impact, stretch if you can, as much as you can, and they should avoid it. Avoid high impact exercises. That's hard to say, because some people enjoy the high impact exercise. So if you can avoid, then that's another way we can do it. Somebody asks, do certain types of weather make the arthritis worse? Absolutely. Extremely hot, extremely cold. It affects more people during extremely cold seasons, but there are people who are affected when it's too hot. So those are the two that usually the two extremes: extremely hot and extremely cold. Medium weather and everything, most people do fine with it, but the too extreme causes inflammation. You've been good for a while, and then you can tell that the weather is becoming cold and your joints start aching more. So that is arthritis. Those are the main ones I had. It is disease that's maintained. You have to maintain it. It's not cured. You just have to maintain it. Stretch, exercise, light exercise, water, swimming, stuff like that to help. Avoid smoking, decrease your weight, and that will help decrease your symptoms. So basically, in a nutshell, that is the arthritis. Most people will get the common one is osteoarthritis, which comes from wear and tear of the joints, or rheumatoid arthritis. But as I said, there's gout arthritis, psoriatic arthritis, ankylosing spondylitis arthritis, juvenile arthritis, rheumatoid arthritis, and osteoarthritis. So basically, those are the main symptoms. Affects women more than it does affect men. All right, guys, you guys take care. Have a great week. Bye-bye.